And how do you get the encouragement, the buy-in, the cooperation of those, rock star surgeons and doctors to participate in this? How does that happen?
Well, we start with data, and we focus on the patient. So that's kind of a two-pronged approach. So number one, focusing on the patient and their needs and the value proposition to the physician. So whenever we ask our physicians or our nurses to do something different than, maybe something extra, we always couch it within safety, quality, language. So when I communicate more effectively with the patient and I can teach them about their new medication or their condition, they're more likely to adhere to the care plan that I put in place for them. They're going to buy what I have to sell, right? And then they're going to get better care because they're listening to me and they're, developing that homegoing structure where they can continue that plan in my absence. So that's part number one. Part number two is really thinking about the data and the science. So a lot of the things that we recommend that you do, things like bedside shift report, where the nurses, when they're changing shifts, they come together, day shift and the night shift, come together to the bedside to talk to and with the patient and to exchange information right in front of them. Same thing with our initiative at the Cleveland Clinic, plan of care visits. So plan of care visit is that daily round where the doctor, the nurse, and the patient all meet together at the bedside. We have incredible data about this. So this improves communication and patient experience, but it also improves safety. It improves the quality of care, reduces things like readmissions, which we see as a failure in the practice of hospital medicine. When somebody is sick and we're supposed to make them better, and then they're supposed to stay better. But if they have to come back to the hospital and they're sick again a few days later, we didn't do our job the way we're supposed to. So when we look at these key initiatives that every physician intrinsically understands, and we can supply data around it, say, if you do things just a little bit differently, if you communicate more clearly, if you explain a little bit better, if you listen better, you're going to have a better outcome. That's the sort of thing that helps change minds and hearts.
Well,